Hello, my name's Dawn and I'm Head of Patient and Public Engagement and Patient Experience. Part of my role is to ensure that our carers and their family have a good experience when they come into contact with our services. Southern Health has made a commitment and pledge to carers. We want to listen to them, support them and give them a voice. We're working really hard to improve the way we listen to and communicate with our carers, and we want to give them opportunities for greater involvement. And of course, most importantly, we want to look after the health and well-being of our carers as well as our patients.
Hello, my name's Adrian Thorne. I'm an appointed governor for Carers Together, and I've been a governor with Southern Health since 2016. As an appointed governor, I have a specific interest in the way in which the Trust supports carers. Southern Health support to carers is not as good as it should be, and I think as a Trust we recognise that, and it is recognised right away across the Trust. The charities support carers very, very strongly within the county. What we need really is more of a partnership between Southern and all the charities that support carers within the county.
Well, it started, I'm surprised to say, all of over 14 years ago. We stepped off a plane from Australia after a once-in-a-lifetime trip and had no idea what was going to face us at home. When we got back, we found our daughter there. She'd come down from London, and a full crisis team trying to support our son, who'd apparently had a first episode of psychosis. We knew nothing about mental health, and we've been trying to learn ever since. So those first days, I can't thank the crisis team enough, and even more, I cannot thank the early intervention team. That was just kicking off in Hampshire. Our son fulfilled the criteria, and they kept him on an extra year, 4 years, to support him to finish his postgraduate studies and therefore qualify him for the career he had always wanted in architecture. So that initial touchdown with Southern Health was relatively positive. And then I don't know exactly what triggered it, but there was a period of not taking medication. And the crisis team were back on the doorstep, supporting as best they could. And very sadly, I can still see the conversation now in which they were so concerned about him. They were talking about a mental health assessment. We weren't sure what that meant at the time, but they were talking about a mental health assessment and warned us that it would be very traumatic for him and very traumatic for the family, which it proved to be. And he was taken into hospital as a voluntary patient. That lasted overnight. He rang me the next day to tell me that he couldn't come home, he didn't know why he was there, and then phoned me again to tell me that I think that they had to restrain him and use a depot injection. And that kind of changed the whole scenario. And there have been, including now, 5 sectionings, and we began to understand the meaning of a revolving door patient. And that saddened us a lot. He hasn't worked for a long time, obviously, and his condition has not improved. And sadly, I now see a young man who has been locked up this November for 3 years. None of us imagined, I don't think staff thought it would come to this. And I have to admit that COVID has not helped that for the last, since the lockdown. And of course, he's very, very anxious about his future. How he is ever going to get a life, get on the property ladder. All he wants are a couple of children, a wife, and a successful career. And that doesn't seem a massive amount to ask for most people. But for him, as he openly admits, is one hell of a mountain to climb ahead of him. I've made a positive move in the last couple of years. I was privileged and asked to speak in various things to do with Southern Health, and I had a sort of light bulb moment when I thought, do you know what? I can keep bleating on to friends, bore carers rigid with how this isn't worked and that communication isn't good and that member of staff, why didn't they retire earlier? But actually, I want to help change things in Southern Health. So I kind of got involved with the families group. I've been on quality improvement workshops, and I've made a lot of friends as carers and service users and staff, and it does make me feel that I'm trying to do something, not just for my son, but for everybody that follows him through the service, because I think we need a holistic approach and we need compassionate mental health. I would say they, and I don't know the ins and outs of their working day, but I would say they probably, I'm talking rather about acute units rather than the community teams, but they all have very high caseloads, very difficult circumstances still at the moment, and we know that resources have been cut back and cut back and cut back. There is obviously the very big issue about confidentiality, and we hear about common sense confidentiality. In the early days, we did suffer, and I understand totally when I hear carers talk about the difficulty, oh, they won't tell me anything, etc. But I've also met amazing staff who have put their jobs on the line to use their common sense, and I felt that our predecessor here, the CEO who was here, did very much. They'd say to all the staff, if they saw it, you know, the buck stops here. We support you. And the very first QI workshop I went on, I was aware, because I was suddenly with staff from an acute unit, who I realised were terrified of disciplinary action or losing their jobs. But when you've got very stressed carers of all walks of life, at all stages of somebody's mental health journey, then you really do need to treat them with compassion, assure them that they can give all the information to you in the world, they can talk to you generally about medication or whatever, and reassure carers that actually they do matter, they are important, they can help their loved one's recovery, however long that takes, however many sectionings it takes. They're very, very important, and I think as hard as it is for them, somehow they've got to get over those barriers and just put themselves out there. And I think the most important thing in that aspect is, you know, how many of them have ever been asked or asked themselves the question, if that was my relative, how would I feel? If that was my relative, what would I want for them? I hope to see them recognised, treated with respect. Some people have spoken as if that doesn't always happen. And I think on my wish list, what I would like to see if my relative goes back into hospital in the future, I would want to be contacted within about 48 hours, if that's a phone call, if I'm actually able to go to a unit or whatever, somebody to recognise me, point me, signpost me to who that carer lead might be, that named person, and I need a phone number or an email address, and I need phone numbers, particularly if it's in the community. Perhaps I need definitely phone numbers or contact information. If this crisis happens on Friday, fine, you phone us here, you phone this number, and somebody will respond. And you know that you've got some reassurance. I think reassurance is a big word. I think building carers' confidence is another aspect that's important. So I think all those things are totally achievable with training, the right people in post, and the trust investing in those staff to deliver what's required and to move everything forward. This has been a long time coming. We know the triangle of care, which is now going to be invested in full tilt, we hope. It's been around a long time. It's been around since 2010. So, you know, I hope we're not teaching our dogs new tricks. We need this now. We've needed it a long time before. But, you know, you can't live in the past. The important thing is, where are we going? What are we all trying to achieve? And I'm very much on board with that. And I'm very happy to support the trust. But I also need to make sure that I'm ready to criticise them when I think constructively when I think, actually, do you know what? You're not up to the mark and you're not actually doing the job that we need you to do. I want this to become an outstanding trust. And I don't see why it can't if it puts its money in the right place and its resources and backs its staff to the hilt.
We know that it's been a particularly difficult time for our carers and family over the past few months. We've spoken to a number of carers who've identified a number of issues. We've already put additional resources into this work, and we've now co-produced a comprehensive plan to address all the issues that have been identified. If you're a carer or you know a carer or family friend and you'd like to be more involved in our work, please do contact us. We'd love to hear from you.